We were also confused, we also had doubts, and we were on the same stage as all these NEET PG 25 aspirants are.
I was confused about two branches, whether to go for ortho or to go for surgery.
लता मंगेशकर ने के पापा ने उसको बोला होता फास्ट बॉलर बन जा, या सचिन तेंदुलकर के पापा ने उसको बोला होता सिंगर बन जा, तो आज वो कहाँ पे होते? We only know that these are the strength people. They got lot of money, the glamour, and everyone is behind them. They're organizing some fest, but this is just the outside, the tip of the iceberg. But when we go deep, when we dive inside the residency, we come to know the real scenario. They're always exhausted. They are having a crisis in their life. They're always sleep deprived, always starving. We don't just fix the joints or the bones. We give mobility to the patients.
If you are getting MS anywhere, आंखें बंद करके ले लो.
पर अगर प्राइवेट सेमी प्राइवेट में MS है, then better to consider.
So hello guys, my name is Dr. Deepak and today we are here for webinar on Ortho is the branch for NEET PG 25 counseling, and we have two esteemed guests, Dr. Shalin Shah sir and Dr. Satish Kriplani sir. Thank you so much sir for both of you to join us. So I'll give a brief introduction about both. Dr. Shalin Shah sir is a consultant knee and shoulder surgeon, currently the sport medicine expert, and is currently working as a private setup of Rutviji Hospital in Vadodara. Also, he did in his MBBS from NHL Medical College and Hospital and cleared NEET in first attempt and got admission in Baroda Medical College SSG Hospital. He also did his fellowship in robotic joint replacement from Viro Hospital Arthroscopy and joint preservation fellowship from Veshvi Hospital Vadodara. Also knee and shoulder arthroscopy from PD Hinduja Hospital Mumbai. And Satish Kriplani sir is also consultant endoscopic and robotic spine surgeon. He also did his MBBS from NHL Medical College and Hospitals, also cleared his NEET in first attempt and got admission in Baroda Medical College, SSG Hospital. He did his fellowship in spine surgery and robotic spine surgery from Kolkata and endoscopic and spine surgery from Baroda. So like we have vast experience with him, with both of them. So at least both will cover like why you should join ortho, why you should not join ortho, all the pros and cons. So thank you so much to all of you for joining this webinar. Hope this webinar will gonna help you. So let's first start with Shalin Shah sir. Welcome sir.
Yes, hello everyone. Good morning.
Yes sir. So what was your purpose of joining?
Yes, well, back in 2020 when we joined, we were also confused. Yeah, am I audible to everyone?
Yes,
sir. So we were also confused. We also had doubts. And we were on the same stage as all these NEET PG 25 aspirants are. And our mentors also guided us that what we can expect from ortho and what are the things you will face in the residency and in the future post residencies. And keeping all the things in mind, yeah, the better choice we made was orthopedics, and you are not going to regret that choice.
True. And Satish sir?
I think I was more confused than Dr. Shailin. We had a conversation. I was confused about two branches. I had to pick a surgical branch. That was for sure. I was clear in my mind. So I had two options, whether to go for ortho or to go for surgery. So yeah, we had discussed. I had a discussion with Shailin. So yeah, ortho, basically, I did my internship in ortho. After didn't have much exposure, but after the results, I went to the department. Exposure of that department, I felt yes, I think I will be able to spend my entire life doing ortho things. So then I made a decision. Yes, I can survive in orthopedics, and I will not regret the decision of taking orthopedics. So it was after I got exposure after my NEET PG results that I made a choice. Okay, I will not go for surgery. I will pick orthopedics. And luckily, we both got in the same college. So we were co-PGs. We did the MBBS from the same college. We did our post-graduation from the same college. And then he opted for joints and I opted for spine. So yeah, it was like a dream come true. It was a dream branch for me after I got exposure in that. So yeah, that's why orthopedics.
Yes, sir. So, Shalin sir, why someone should join ortho? What pros and cons do you think?
Yes, we are going to definitely cover each and every aspect, starting from what are the advantages, what you can expect from orthopedics, and all the doubts which people have regarding the toxicity. Is there a saturation in the field? That should you pursue MS or you should go for a DNBC? We are all going to cover these things, and we have a small presentation made for every one of you to make it interesting. It is not a boring thing. Orthopedics don't like things boring. And so let's then quickly shift to the presentation and the things will be clear. We'll give enough time for everyone to ask their questions and all the questions will be answered. But we have made a brief presentation in which we will cover your majority doubts. So that's doubts, you don't end up asking the same things. So everything will be streamlined.
So I guess like plenty of people have joined, so we can start.
Yes, welcome everyone. Myself, Dr. Shailin. I'm a consultant knee and shoulder surgeon at Ritwich Hospital in Vadodara. And and this is my colleague, Dr. Satish, consultant spine surgeon. Okay, Dr. Satish, can you switch on to the next slide? Yeah, the post PG, the most difficult thing, the most difficult choice you will have to make. And this is where the roads differ. We are lucky as medicos that it is after the age of 23, 24, we have to select our choices. Whereas engineers, they have to commit themselves at the age of 18. And you know, many of your friends would be engineers and they don't end up doing what they started what in their engineering career. So this is a very important choice where our paths are going to change. Okay, any one of you can type in the chat box. What does this from where this reference is taken? Okay, this is from the famous movie. Yeah, I've got an answer from Dr. Manish. You are absolutely right. But let me explain it for everyone else. Yeah. कि लता मंगेशकर ने के पापा ने उसको बोला होता फास्ट बॉलर बन जा, या सचिन तेंदुलकर के पापा ने उसको बोला होता सिंगर बन जा, तो आज वो कहाँ पे होते? See, that is the thing, that first you should be knowing that what is the right thing for you. You have to have it inside you that yes, I'm going to pursue that field, it is for me. You should be having the strength and the support of everyone so that you can go ahead in that field. And this is the selecting the right person for the right job. And in the internship, we are not exposed to what is orthopedics. It is a iceberg phenomenon. When we pursue our MBBS, we do not have any idea what is going on in the wards, in the hospital, in the OT theater of an orthopedic. We only know that these are the strength people, they got a lot of money, the glamour, and everyone is behind them. They're organizing some fest. But this is just the outside, the tip of the iceberg. But when we go deep, when we dive inside the residency, we come to know the real scenario. They're always exhausted. They are having a crisis in their life. They're always sleep deprived, always starving. And there will come a stage in everyone's residency when they take up orthopedics that why did I take up orthopedics? This stage, everyone has to pass through it. And those who successfully pass through it are going to become extraordinary. They would have extraordinary strength to face any challenges in their life, because orthopedics makes you grind. And once you pass through it, you would realize that nothing has become impossible for you. There is a quote that gem cannot be polished without friction, nor the man can be perfected without trial. Strength doesn't come from what you can do. It comes from overcoming the things which you once thought you could not. So you have to fight through these bad days to come out and get the best days. Next slide, please. Yes, this is one of the things which orthopedics as a branch is going to offer you. Yes, the stakes are high. The patient would be in crisis. Everyone will be looking at you. And in between, there would be an orthopedic surgeon who is going to fix the broken bone, who is going to relocate a dislocated shoulder. And all the credit he would be getting. Yes, there would be a complete team effort, but he is the man who will be standing in the middle. He will be on the center stage, and whatever decision he makes on that day, on that moment, is going to be seen by everyone present in the casualty or in the operation theater. Yeah. Next slide, please. See, the orthopedics is a very thrilling branch, and we don't just fix the joints or the bones. We give mobility to the patients, something which is related to instant gratification. The first thing you can see in the slide is a deformed spine, and see how the surgeon has wonderfully fixed and corrected the deformity. These are the things which you can express. You can see the patient's relative can correlate कि हाँ ये तो टेढ़ा था आपने जोड़ दिया. In the third slide, you can see that's a fractured femur and how beautiful it is fixed by a nail. So the patient's pain is gone, and you have a great job satisfaction in which the people are going to be thankful to you. And even the patient is going to be extremely thankful because he will be able to walk again. In the second slide, we can see how the ACL ligament is reconstructed, and for the sports people, and they're again back on their feet running. You can see how we replace a joint when it is deformed. See, these are the things which are going to give you thrill. What I mean by thrill is, you once in your life, in your childhood, every one of you must have thought that हाँ घर पे कोई अगर चोर आ गया तो क्या करेंगे कि रात को चोर आया and we will be the ones who will fight with them. We will punch him in the face and we will save our entire house. Yeah, this was a dream of every childhood person. And guess what? Orthopedics is going to give you a chance to become a hero and to live the dream. A famous, yeah, there is a lots of question regarding, shall I take up MS ortho or DNB ortho? Well, technically, I can say that both are equivalent. From the degree perspective, MS and DNB all are equivalent. But when you sit in an interview and you are with the corporate and one MS guy has given the same answers and same way one DNB guy has given the same answers, then if everything matches, then I feel MS would be given a slight priority, just for a few reasons, which I will come forward. The case variety. In MS, there is a huge exposure, especially trauma. Our morning starts from 9 to 5 OPD. We see around 300, 400 patients in this time. Then our emergency starts from 5 o'clock and it continues till morning 5 o'clock, 6 o'clock. So 12, 13, 14 hours, we are continuously operating till all the patients are treated. And there's a huge exposure to variety of cases, including trauma, arthroplasty, which is a joint replacement, spine, pediatric cases, and you get all the cases exposure in MS. Whereas in DNB, those are the private colleges. The patient will be spending a lot of money for the treatment. And so definitely the case variety will depend on institution to institution. If you go for a higher institution, more famous, definitely you will get a lot of variety, but it is not a certainty that you will encounter, or rather you will be able to do that case by yourself independently. The hands-on training is excellent in MS ortho, whereas in DNB ortho, again, it varies according to different centers. The pass rate is really high in MS, and that is one of the reasons people also prefer. Whereas DNB exams are tough exams, you need to be really strong academically and you have to study throughout your residency to make it happen. When you come out of the residency, what matters? Yeah, these 3 years you are going to clear it. But once you are out, you will come out as a confident trauma surgeon. Whenever, in whichever branch, in whichever college you pursue your MS. But whereas in DNB, the number of cases which you would have done independently would be lesser. But rather you will be very strong academically. So you will have to spend 1 or 2 years doing your senior residency or spending in a government institute where you can practice everything that you have learned in your DNB institute. Whereas for a MS candidate, I feel that it's an optional SRship. Majority of cases you have done it, and that is independently. So this is going to give you an edge to pursue your fellowships once you are cleared your MS. But again, with all the advantages, there comes few disadvantages, that the toxicity levels are really high in MS. The higher working hours, you in the emergency and post-emergency, you don't get to sleep hardly for a few minutes, not more than that. Yeah, that the things are tough in MS because you have a lots of patient load, and as you are working 24 hours, the scope of academics is very limited. Whereas you in DNB, they've got a good work-life balance in which you study, you see, you assist them in the OT, and you also get a lesser hands-on, but you still get a hands-on depending on the institute. Yeah. Next slide, please.
Just a second, Shailin. I would like to interrupt.
Yes.
I'm having a minor technical issue. I'll be back in a moment. Just a minute.
Yeah. There is a question from Dr. Shivani that can a female candidate sustain after an ortho? Yes, we will come to that. We will answer all your questions.
Till then, sir is connecting. You can also drop your questions, guys. So we can have few questions. You can take few questions in between. Hi, Aryan. Sir said that if there is a two candidate, one is MS and one is DNP graduate, and if both are giving same answers in interview, then the preference will go to more toward the MS guy.
Yeah, Satish, Dr. Satish is back.
Yeah, sorry for the delay. Yeah, you can start.
Yes. So when you, can you switch to the next slide? Yes. This is a very common question from everyone, that what is saturation and does it really affect as an orthopedic? Well, when you compare the data, the IIT May 2024 data, that 38% of the IITians were unplaced, whereas 46% of all the business school people, they were also jobless. And when we compare it with medical field, no such data exists. Majority, or rather I would say 100% of the people are employed. So when you compare saturation from medical to other field, it is definitely more in different fields than a orthopedics or a general surgery or a medicine. But yes, the saturation inside the field also exists. But is it a reason to worry? I would say no. In tier 2, tier 3 city, there are plenty options available. Yes, in tier 1 city, metro cities, there will be difficulties, but we also have different options and variety how to tackle that situation, which Dr. Satish is going to guide you. When you compare in orthopedics, there is one orthopedic per 71,000 people. So definitely I would not say that this is a saturated branch. In obstetrician, that is one OBGY per 94,000 people. But here the data can be skewed because this includes male plus female. So after doing your MBBS, there is a guarantee that you will be getting a decent job and be earning a decent amount, whichever branch you take up. I would like to pass it over to Dr. Satish, who would be able to guide you more regarding what are the challenges a first generation doctor would be having and how to tackle all these problems. Over to you, Dr. Satish.
So hi guys, I'm audible? Okay. So yeah, first generation doctor. Yeah, first generation doctors, things can get difficult. I myself am a first generation doctor. So yeah, things can get difficult. सब बोलते हैं saturation है. यार एक बात बताओ, saturation कहाँ नहीं है? Every field is saturated. You talk about engineering, you talk about anything else, CA ले लो, कोई भी branch ले लो, कोई भी field ले लो, everything is saturated. If you look into that way, ठीक है. But if you look the other way, के हर जगह scope है, then you will realize कि yes, scope है, हर जगह है. So first generation doctors, the struggle is real. Yeah, it is real. Things can get difficult. Like no family connections and all. You, मतलब एक रहता है. There's stress regarding the future job opportunities, investment. The investment money is large. You need to, if you want to start your own setup, but it is not impossible. Definitely, it is not impossible. You need to keep thriving. You need to keep hustling. You have to dare to dream. And after you achieve your goal, the satisfaction you will get will be immense. You need to find a way out. Man, there's definitely a way out. There's no chance ke koi rasta nahi. There's definitely a way out. So one thing I would say to tackle such thing, one is ke you have to stand out. Saturation mein, the most important thing is standing out. You have to stand out from amongst the crowd. If saturation is present in every field, but you need to stand out. One way of standing out is doing super specializations. MS Ortho earlier was considered as an end branch. So that brings us to an important question. Okay, end branch. Is it really an end branch? So I will share you a story. When we were thinking about taking orthopedics, me and Shailin had a discussion. Hey, Shailin told me, he was more confident in I want to go for ortho only. I was a bit confused between surgery and ortho. So I asked him, how are you so confident that you need ortho only? So he said, NEET PG नहीं देना वापस यार, NEET नहीं देना मेरे को, कंटाल गया मैं NEET PG देख के. मैं बोला यार हाँ वो तो सही बात है, मैं भी थक गया हूँ. It is तब we thought कि यार end branch है, ले लेते हैं end branch. 3 साल करना है, SRship करनी है, फिर खत्म कर लेंगे, फिर अपने फील्ड प्रैक्टिस करेंगे. तो we ended up taking orthopedics. We completed our journey of 3 years. After 3 years, after we got our degree from the university, हम दोनों थे, we were sharing, we were like clicking our photos. Our mentor came to us. उन्होंने कंधे पे हाथ रखा, तो बोले कि डॉक्टर साहब वो देखिए सामने, कैमरा के देख के हाथ हिला दीजिए, आपके साथ प्रैंक हुआ है. So it is not an end branch. Definitely not an end branch. Fellowships will become mandatory in the coming years. So after entering orthopedics, first and foremost, you need to concentrate on trauma. कि पहले तो सबसे पहले you need to be confident enough in trauma. Along with that, you will have to look for options. कि ये 3 साल बाद, 4 साल बाद, what will you do? What will you pursue in super specialization? Fellowships are an option. So fellowships के लिए there are various fields. 3 topmost fields I will say. Arthroscopy is quite in high demand right now. Sports medicine, that is. After that comes the arthroplasty, but arthroplasty is just bread and butter. So it is like you, after completing your MS Ortho, you should be able to do replacements, knee replacement, hip replacement. So arthroplasty is another field. Another upcoming branch is spine. So spine is also another good branch. Another branch is like hand surgery, foot and ankle, Ilizaro, pelviacetabular surgeries. So these are various fields, pediatric ortho, onco ortho. So there is a lot of scope. So you can pursue this, and there are exams as well. जैसे we were discussing के 3 साल के बाद exam नहीं देनी, कोई entrance exam नहीं देनी. But yeah, you might need to give FNB for various specialties like arthroplasty, arthroscopy, spine, hand, foot and ankle. So FNB is a fellowship of national boards. So I guess in the upcoming years, by the time you get out of ortho, after completing your 4 years, fellowships का importance और बढ़ जाएगा, and it will become more mandatory in the coming years. And another is NEET MCH. NEET MCH as such इतना recognition नहीं है अभी इंडिया में. Very few branches, hand, pediatrics, and some hand surgery, pediatrics, and spine bhi, but there is one institute, AIMS Rishikesh. You can pursue MCH spine surgery. Another example is ASSI, Association of Spine Surgeon of India. If you are confident, you have decided that after orthopedics you want to go for spine, so ASSI is another option. You can get a fellowship of 2 years. So FNB offers 2 years fellowship, ASSI offers 2 years fellowship. So it is not an end branch anymore. As I said, you need to stand out, and one way to stand out is doing fellowships and getting get a super specialty degree. So that is one thing. So another important question कि 3 साल तो बाद तो बता दिया कि 3 साल बाद स्कोपी है, प्लास्टी है, स्पाइन है, बट ये 3 साल कैसे निकलेंगे? तो फर्स्ट एंड फॉरमोस्ट यू मस्ट कॉन्सेंट्रेट ऑन these 3 years. तो 3 years when I entered college, और जब कोई भी कॉलेज एंटर करता है, नॉट एमबीबीएस, पोस्ट ग्रेजुएशन, एंड स्पेशली ऑर्थोपेडिक्स, जो ऐसे बोलते हैं कि ऑर्थो पीपल ये दे आर लाइक मस्कुलर गाइज, दे आर चार्मिंग एंड ऑल दैट. सो एवरीवन हैज दिस एक्सपेक्टेशन कि आई विल एंटर इन एन ऑर्थोपेडिक कॉलेज, आई विल एंटर द डिपार्टमेंट ऐसे जैसे सिद्धार्थ मल्होत्रा एंटर हो रहा है, ठीक है. बट एंटर होते ही अ फ्यू मोमेंट्स लेटर हमको औकात पता चल जाती है. हमारा सीनियर हमको मिलता है जो हमको बोलता है पप्पा जी बोल हरामखोर पप्पा जी, और फिर दूसरे ही मोमेंट पे कुछ काम देता है और बोलता है बेटा तुमसे ना हो पाएगा. सो यस, टॉक्सिसिटी इज देयर, डेफिनेटली टॉक्सिसिटी इज देयर. आई विल नॉट से लोग बहुत ऐसे everyone has created a havoc regarding orthopedics ke it is a very toxic branch, the seniors are very toxic, you don't get time to sleep, you don't get time to eat, you don't get time to go for bathing. So ये सब they have created a havoc, I don't know, and all this havoc, it is true, I will say ये सब सच है, ठीक है. तो you will be ending up with sleepless nights, 48 hours to 72 hours duties, like you will be in the emergency for 24 hours. You will complete your emergency duty by 6 or 8 a.m. in the morning, and the next within 15 minutes you will have to rush to the OTs, or you will have to rush to the wards to do your work. So yeah, it is the toxicity is there, and a few more moments later you will realize साला ये दुख खत्म काहे नहीं हो रहा. So there will be sleepless nights, there will be no time to eat, no time to go for bath, toxicity from seniors, constant work, emergency, OPDs, OTs, and all these things double up when you are away from your hometown. So you have to manage everything. So it is quite a hectic branch. Like you will be equipped with work every now and then, every minute you will not be able to sit. But yeah, उसका भी एक अलग मजा है. When me and Shailin sit sometimes and talk about our first year, so we have some great memories. Like even after those toxic years, we enjoy. We say कि नहीं यार, वो it was because of that 1 year. It was because of that 1 year we were able to sustain. We were able to become something in life. So I think ये 3 साल हैं. Residency has to be hectic. Chill residency का कोई फायदा नहीं है. Chill residency is a useless residency. So residency has to be hectic. Don't worry कि सोने नहीं मिलेगा, ये नहीं मिलेगा, खाने नहीं मिलेगा, पीने नहीं. You will be able to find a way out. Definitely. I was able to find a way out. Dr. Shailin was able to find a way out. So every one of you will be able to find a way out. You will be able to survive those years. And after those years, you will come out more stronger. So how to tackle these things? Take one day at a time. Remember the thing, this too shall pass. ये जो है, all is well, it's a movie नहीं, it is in real life. It is in real life, and I have a personal experience. I used to console myself कि नहीं ठीक है, हो जाएगा, पास हो जाएगा. And after that 1 year, like things get easy. ऐसा नहीं है कि 3 साल toxicity रहेगी. It is the 1 year which is the most toxic. After that you become senior, you have juniors working under you. So basically it is that 1 year जो लोग डरते हैं लेने के लिए. But I will say, if you want कि नहीं orthopedics ही करना है, don't think about toxicity, don't think about saturation, just go for it. You will be able to find a way out, and whatever doesn't kill or break you only makes you stronger. So remember that thing. So yeah, it is going to be toxic, but it is going to be fun. You will learn a lot of things. So the survival kit, एक survival kit चाहिए होता है, and those are your co-PGs. You remember this dialogue from 3 Idiots? दोस्ती इंसान का सबसे बड़ा स्तन होता है. Yeah, it is true. And after you are bashed by your seniors, after you are bashed by your consultants during the rounds, it will be your co-PG only जो आपको बोलेगा. After all those bashing, when the consultants leave, when the seniors leave for a few while, that co-PG will be the only one who will come to you at night, 2 a.m. or 3 a.m. or 4 a.m. He will come to you and say, Madira piyoge? And you will enjoy drinking Madira. So this is the thing. You will even if I go back to my first year residency, so I enjoy those days. Those were the best days of my life. Residency जितना hectic होगा उतनी ज़्यादा memories बनेगी, उतना ज़्यादा आप काम सीख पाओगे, उतना ज़्यादा future में tackle कर पाओगे सारी चीजें. So after you complete your ortho residency, you become a jugaadu. You will have a solution to each and every problem. That's my personal experience. आपको ऐसी कोई problem नहीं होगी कि जिसका आपके पास solution नहीं हो. And you will reach a God level adaptability. कि આપણને બધું જ ચાલશે. कि no matter what, you don't give me a bed, I will sleep on the floor. If the floor is not empty, if the floor is dirty, I will sleep on the stretcher. Even I will sleep next to the patient on his bed. Those things like adaptability, you will reach that level of adaptability that you will be like kuch bhi ho jaye, I will be able to survive. And that is really important for a surgeon. During surgery, you will be under a lot of stress, but you will remember one thing, okay, if I am able to pass that 1 year, those 3 years of orthopedics, then ये तो कुछ भी नहीं है, ये तो कर ही लेंगे यार. ठीक है, तो it is not like that कि toxicity is there, but there are various ways that you can tackle it. And if you have passion for orthopedics, then you will definitely find a way out of it, and you will love it. You will love your hectic working hours. You will love running here and there. You will enjoy the things. You will love taking care of the patients. So it is ultimately, you will learn everything. So passion and sacrifice. Without sacrifice, you will earn nothing. If you don't have passion, you will give up. So take up orthopedics only if you have a passion for it. If you feel like nahi, main is branch ke liye hi bana hu. So you need to be clear for that in your mind. No matter what, I will be able to survive it. I will be able to do the things, and I want to do the things because you are passionate about that branch. So now, if you tell me to read for even for studying as well, if you tell me to read for 16 to 18 hours a day, and I will be able to do it, but the condition being the subject should be orthopedics. I will be only because I'm passionate about orthopedics, so I will be able to read for 16 to 18 hours if it is orthopedics. If you give me any other branch, I might not be able to read it. I will not be able to give 100% because I'm not passionate about that branch. And if you have goals, if you want to achieve something, then there's something you need to sacrifice. So it is said the biggest decision you can make about your goals is what you are willing to give up in order to achieve them. All those sleepless nights, all those hectic hours, all those running here and there, all this will pay off if you work hard and if you have a passion about it. And after you complete your this 3 to 4 years of residency, तो तुमको ऐसा लगेगा, कभी नहीं, तुमको हर बार ऐसा लगेगा साला अपुन ही भगवान है. So this is the thing, this is the reality about orthopedics I'm sharing. ये कोई वो hype नहीं है. It is the thing which I experienced, which Dr. Shailin experienced, which we experienced together, and it is all reality. It is not a hype, and this is nothing hype. So when I entered residency, 2 things I kept in mind. These 2 sayings I kept in mind. Like you need to motivate yourself, right? Motivation and discipline, दोनों चाहिए होता है. But there will be days जब senior इतना पेलेगा आपको कि आपको लगेगा कि साला छोड़ देनी है ब्रांच अभी यार, इतना कौन स्टैंड करता है. बट remember, I used to remember these things. When the going gets tough, only the tough gets going. And another thing I used to remember, the more you sweat in your training, the less you will bleed in battle. So give your hours in training, be passionate about the branch. All these things will pay off. And ये सब टॉक्सिसिटी है, जो सोना नहीं मिलता, नहाना नहीं मिलता, खाना नहीं मिलता, ये सब भूल जाओगे once you enter into the branch and if you are passionate about it. Yeah, it is quite easy to say because I have passed that stage. Being in that stage is difficult. I have gone through that phase, but yeah, I think के हो जाएगा. If you are determinant, then definitely हो जाएगा. So that's all from my side and Shailin's side. Thank you very much. So we'll answer your questions now. Any questions?
Yeah, they have already written lots of questions for us, Dr. Satish, in the chat box.
Okay.
Yes, and before, just I would like to clear one thing, that would be a common doubt for every one of you when Dr. Satish shared that meme, that Madira piyoge. Yeah. So it is not about your seniors, not about your colleagues. It is always a choice. If you want to have it, you can have it. If you don't want to, no one in the world is going to force you. Remember that thing. If you are a non-drinker, and I will just tell you, in spite of telling this, Dr. Satish is a non-drinker. So no one has ever forced him to do anything in orthopedics. It is not a prison for you that you have to do things out of compulsion. No, that is a myth. In the reality, it is always on you. It is the choices which you make that is going to determine what the next step is going to be. So let's start. We'll do it, Dr. Satish, one by one.
Yeah.
The first question I would like to take of Dr. Shivani, that can a female candidate sustain after an ortho residency? Okay, well, that is my belief. It can differ from person to person. I feel there is no gender bias. There is a, like, you need a lot of strength, you need a stamina. Yes, these are true. But if you need excessive strength, then I must tell you, you are doing it in the wrong way. It is always about the technique, not about the strength. Myself, I would like to share my personal experience. I am not one of the strongest guy, but there are few cases where you will have to apply a lot of strength, but we have got modern tools available now. Before 20, 30, 40 years, we used to do everything by the hand, but now we have got automated machines, the sharper drill bits, and the technology has creeped in orthopedics. So taking up orthopedics as a girl, I don't think that will be an issue. But yes, the environment, the majority of the people would be boys. So you will have to adapt to that environment, adapt to the lifestyle. But it won't be a problem.
Yes, and वो डायलॉग भी है, हमारी छोरियां छोरों से कम है के, तो छोरियां कम नहीं है. They can take up orthopedics. Female can take up orthopedics if you are passionate about it. Gender कुछ नहीं है, और those are some myths जो पहले होता था. Now I don't think so कि ऐसा कुछ है कि females cannot take up orthopedics. You can take up orthopedics if you are passionate about that branch. And many of my, I have seen many of my colleagues, they are females. They are doing very much, they are doing good. Like some of them are in spine, some of them are in arthroscopy. So those fields don't require too much of strength. And yeah, it is said that strength चाहिए होता है, but ठीक है, initial years में you might require the strength, because the tools might not be available. But as you go in private sector, there are automated tools जो easily चले जाते हैं. Even boys don't require strength. अगर boys को भी strength नहीं है, तो ऐसा नहीं है कि लड़कियां कोई लड़के भी होते हैं जिनको strength नहीं होती है. So they can take up orthopedics. So it is not about strength. It is about passion and your will to survive in orthopedics. Yeah.
Okay, the next question is from Dr. Sanket, that please tell 10 colleges to take up with hands-on and toxicity overall. See, there is a famous saying, that don't teach me fishing. I will eat the fish for one day. Instead, teach me, sorry, I would like to reframe. Don't give me a fish. I will eat for one day. But instead, teach me fishing. I will eat rest of my life. So to suggest top 10 colleges, we can give you the path. What are the criteria on which you can select a college? But to take up the option, that is on you, that you have to, in which criteria you would like to go ahead. That if toxicity is a big concern for you, you can select accordingly. And there is no comparison between Delhi, BHU and all these colleges. Every college has some advantages, every college has some disadvantages. And to know more about specific colleges, I would say you have to prefer to consult one of the pass out of that college. He will be the best one to guide you that what is the real thing inside the college. The next question I would like Dr. Satish to take up, of Dr. Aryan.
Yeah, I missed the point where you were comparing MS and DNB graduate for the job interview. Who will be preferred, sir, and any additional point related to that? So see, MS and DNB are at present. So there's, as Dr. Shailin pointed it out in the presentation, that both have got equal job opportunities. Even as a faculty now, I guess the government colleges have started accepting DNBs. Even in private sector, there are some private hospitals that prefer DNB over MS, considering they have worked in private sector. DNBs have worked in private sector. MS orthopedics, they usually work in a government sector. So it is like the branch should be given more preference rather than the degree, definitely. But if you are getting MS anywhere, आंखें बंद करके ले लो. MS अगर आपको मिल रहा है, and another thing, you are getting a DNB, MS in a government college and DNB anywhere else, MS आंखें बंद करके MS ले लो, ठीक है. But if you are getting MS orthopedics in private or semi-private, then you must consider a DNB in a superlative institute where you can get a good hands-on. So yeah, MS orthopedics, if you are getting both, then prefer MS orthopedics. But if you are getting DNB, then then you don't need to be dejected. It is at par with MS now. You are academically more strong. So earlier there was a discrimination, but I don't think so at present there is any discrimination. If I guess Shailin would like to add some points to that.
Yeah, after all, I feel it is about the skill. See, yeah. Here you are like 50, 100 of people. Every one of you has done your MBBS from different colleges. And when you retrospectively think, does it really matter? So the thing is about how well you adapt and how skillful you become after residency. So even if there is a DNB candidate who has got a very good surgical skill, academically strong, then he will definitely win over an MS who has not done anything. Who isn't able to perform good surgeries. So after all, it is just a degree. What determines is your skill set, how much you learn out of the 3 years. That is more important. Degree is just a tag. Don't be overwhelmed by it. But yes, when you compare the odds of MS doing a good surgery are higher, but that does not stop a DNB candidate from doing a great surgery.
So I would say if you are doing DNB and if you are not getting enough hands-on, then I guess after DNB it is mandatory to go for an SRship in a good government hospital. I guess then you will be equally at par considering the hands-on as well. And another thing I would say, the patients will come to you looking at the degree once, but after that, if you want the patients to keep coming, the things that will attract the patients is your skill and the way you talk to them, the way you show your knowledge and the way you treat them. Degree सिर्फ एक बार देख के आएंगे लोग. बाकी अगर if you want patients to keep on coming, then that is your skill. You need to work on your skill, whether it is MS or DNB. So next question, order of college for MS Ortho. I think Dr. Shailin has already pointed it out. The next is, what are the basic surgery one should learn during residency? Basic surgery, I would say trauma. 3 years trauma, you should be well equipped and you should be well aware of each and every surgeries in trauma. Complex trauma hai, infections hai. Trauma is a basic surgery. It is a bread and butter that you should know during the after coming out of orthopedics, after those 3 or 4 years, you should be well versed with trauma surgeries. So that is the basic thing. And if in your institute you are having exposure to super specialties like arthroscopy, arthroplasty, then it is a cherry on the cake. So basic surgeries, it is the trauma surgeries. Each and every trauma surgeries, complex trauma. If your institute offers you complex trauma cases, then it is well and good. And if you are having exposure to super specialties like spine, scopiplasty, then it is an added advantage to you.
Yes, absolutely. That you can compare yourself. You have been through the MBBS, and when you retrospectively feel that what was more important, it was to learn the basics of anatomy, physiology, biochem, everything. That was more important rather from day one to focus on just the MCQ. So that is the same thing. Trauma is the anatomy, physiology of orthopedics. So just focus on it, go with the flow. Don't get ahead of yourself that I have to learn this surgery, I have to learn this surgery. In 3 years, 3 years is a big time. 1,000 days, more than 1,000 days. You will learn everything.
The next question is, are there any differences in scope of job post MS and post DNB, and if so, how? It depends on cities to cities. I don't think so at present there is any difference in MS or DNB. Yeah, MS can be given preference in a government college. 2 candidates, one is MS, one is DNB, both equally skillful, both equal at par, both are knowledgeable, then I guess MS gets an edge. But itna bhi zyada nahi hota, but yeah, MS might get an edge. That's why I said कि if you are getting MS in any college in any government sector, आंखें बंद करके ले लो. But yeah, ऐसा नहीं है कि DNB के लिए कोई भी scope नहीं है. There is a lot of scope for DNBs as well if you pursue super specialization and everything, as we already pointed out. Anything else Dr. Shailin would like to add?
Yes, I feel that in MS and DNB, you start at different levels, I feel. In MS, you first do lots of hands-on, and then later, at the end of the 3rd year, you switch to the academics and learn the academics. Whereas in DNB, the things are reversed. First, you learn a lot of academics, how to treat a patient, how to apply a slab, what are the principle of plating. And post your MS, that is when you refine your surgical skills, when you do a SRship in a government institute. So either way, at the end of 5 years, I guess everything is covered. For MS, the academic part is also covered in 5 years. And for a DNB candidate, the surgical operative part is also covered. So not much difference, but as Dr. Satish rightly pointed out in a nutshell, that government institute में मिल रहा है MS, तो सोचना ही नहीं होता है. पर अगर private, semi-private में MS है, then better to consider DNB in a metro or a big hospital.
Yeah,
I guess this clears all the MS and DNB doubts.
One question about DNB, like the DNB passing rate is very low. That is the major issue for DNB.
Yeah, so I was coming to that point, the exam pattern and the passing ratio. So exam में क्या होता है, in an MS exam, you write the theory, you give the practical straight away, and the passing rate is high. DNB में what happens? First you give the theory, you need to pass in theory. MS में क्या होता है, combine होके pass होना होता है, theory and practical. But in DNB, first you give the theory. If you pass in theory, then you are allowed to give the practical. Practical में there will be 3 attempts. First attempt में नहीं हुआ, you go for second attempt. Second attempt में नहीं हुआ, you go for third attempt. But if you fail in the 3 attempts, then you need to give the theory again. If you fail in theory, you give the theory again. So the exam pattern is a bit tedious and a bit difficult, tougher examinations. Also, the DNB centers, the college which you passed out, the college where you work for 3 years, वहाँ पे आपको practical exam नहीं मिलता. You go to another college, जहाँ पे 4 external examination हो जाएंगे, examiner हो जाएंगे आपके लिए. The 2 from that college where you are giving your exam and 2 from another college. So that एक वो हो जाता है. But when you are in MS, You give your exam in the same college, and 2 of your faculties will be the internal examiners, and 2 will be coming from outside. So you get an edge. The faculties who are the internal examiners might know you. Ye ladke ne 3 saal kaam kiya hai. And if you end up making some blunder or a mistake during the examination, the internal examiner will cover it up. I will tell the externals that he has worked, he is good, and you will get you will pass. But DNP में ऐसा advantage मिलता नहीं है. So passing rate is less. Yes, the exam pattern is tedious, and you go for an external examination. So, but I think if you are knowledgeable enough, if you have done your residency, and if you have learned the things, and if you have read the books, and you have gained knowledge, I think passing rate shouldn't matter to you. Both Shailin and I have done our MS, then we gave our DNB exams. We made it out in the first attempt. So it is like you don't worry about the passing rate. Yeah, it is a concern. That's why I said MS in a good college. But DNB passing rate is less, 20 to 30%. But if you are knowledgeable enough, then you will be able to pass it out.
So you should be not worrying about the 80% who don't pass. You should be rather be in the 20% who is passing. That is about the mindset which orthopedics is going to teach you. That even if there is a 1% chance, I will be among that 1%.
Yeah.
Okay. Now let's take up the next question. Dr. Parth, the main doubt which I am still having, and I guess most of the people have, is whether to take up general surgery or to go for an orthopedics. Yes, Dr. Satish had pointed out in his presentation that, see, first, it is about both are good branches, but when you have to compare the pros and cons for it. You will be required to do a MCH after a surgery. You will have to give a NEET SS and secure a good rank, go in a general surgery. But if you're ready to do it, there is nothing like it. If you come out to become a plastic surgeon, a vascular surgeon, urologist, see, these are amazing branches. You can definitely go ahead with them. Yes, there is just 1 year of extra stress you will have to pass through, but it is not impossible. You have done it in your NEET PG. After 3 years, you will again do it. So the thing comes out that what is your inclination? What is your liking? See, in general surgery, it will be about, the residency will be about dressing, the open wounds, the examination part. And I am sure you must have done your general surgery posting very regularly. But whereas orthopedics point of view, you might not be so much aware that what happens in the ward. So it is upon your liking and your passion for the branch. And if at all I feel that if you're doubting that is orthopedic right branch for you, then I must say that don't take up orthopedics. First, you have to be sure that I am made for this and I'm going to do this. Then only it is the right branch, because the difficulties are going to come. And once you have passed that difficulties, you are going to be extremely strong to tackle any situation. Dr. Satish would like to add something.
Yes, I think you have covered each and every point. Passion is the main thing. Passion होना चाहिए branch के लिए. Orthopedics हो या surgery हो, सारी branches सही हैं. Every branch is good. Every branch is saturated, but every branch has its own way to tackle things. Every branch has its own way to tackle the saturation. So yeah, as Shailin pointed out, after surgery, neurosurgery hai, plastic surgery hai, cardiothoracic surgery hai, vascular surgery hai. So those are the things जो आप अगर if you want to pursue, some might have किसी को ऐसा होता है कि नहीं पहले से ही कि I want to become a neurosurgeon, then you take up surgery. मतलब your inner self will guide you. मेरा बोलूँ तो there were two things. I went to the internship, I went to the ortho department, saw the things there. I had been in surgery department. I used to find things very gross there. I went to orthopedics. Orthopedics में मजा आया मेरे को. Second thing, तब कबीर सिंह आई थी. Kabir Singh, I saw Kabir Singh drilling through the bone. यार तो भी करना है. So
it is about the thrill.
Inner self आपको बता देगा कि which branch is suitable for you. So next question, what is the timeline in present day scenario to become an independent orthopedic surgeon for sports medicine? So sports medicine, I would like Dr. Shailin to throw some light on it. He's a sports medicine surgeon.
What I feel after your 3 years of residency, the SRship is optional. You can do, you cannot do, but at least I would feel you need a 1 year of fellowship in sports medicine. That is the minimum for you. It could be from two different places, where you first go for a 6-month fellowship from one place, then another 6 months in some bigger institution or thing. But 1 year is a good timeline, I would feel. And if you have done your residency nicely, you have done all your trauma cases, I guess in 4 years, you will be a good, you are a qualified sports medicine surgeon. And after all, the hands-on and the training for a surgeon's life is always slow. There is a graph, and you will have to practice day in, day out to become master in your field.
Yeah, so the timeline will be 3 years of residency, 1 year, 1 year of SRship. I think it is optional, but I think you should go for a 1 year of SRship, at least 1 year of SRship, and then fellowships, as Dr. Shailin pointed out, 1 year of fellowship, minimum 1 year of fellowship. And if you want to do FNB, if you want to give the exam, go through the channel route, then you can go for a 2-year fellowship. But I guess for a scopy and plastic 1 year fellowship is enough. Then you need to work on yourself. फेलोशिप्स के बाद भी ऐसा नहीं होगा कि नहीं आप अगले दिन से ही सर्जरी आर्थ्रोस्कोपी करने लगोगे. You need to work on yourself. You need to practice those things day in and day out to become an independent sports medicine surgeon. So the timeline is, surgeon का graph हमेशा initially slow ही जाता है, then it exponentially rises up. So that you need to tackle that slow path and have belief in yourself. Okay, nahi, if I do proper training and if I work on this slow path, then the rise will be exponential. So next question. So what should our priority according to you right now as a budding orthopedic surgeon? Better academics or good hands-on? Good hands-on. Definitely, no choice about it. Good hands-on is necessary. Academics तो आ ही जाता है 3 years में, आप पढ़ाई पढ़ी लोगे academics का तो. And academics as such आपको कोई spoon feeding नहीं करेगा कि आपके lectures नहीं लेगा कोई. You will have to learn on your own. आपको खुद ही पढ़ना पड़ेगा, आपको खुद ही knowledge gain करना पड़ेगा. You should keep on. You should be updated about the things. So good hands-on, I guess, should be your priority.
Yes, absolutely, Dr. Karthik. Yeah. And the next question, Dr. Sumit Patel. Sir, I am not sure if I like ortho or not, but at my rank, these are the subjects I can get. I don't want to prepare any more. How should I decide? Yes, if you are, first thing, you have yourself stated that you are not sure if you like ortho or not. This is the phase in which everyone of us has passed. I feel you should shadow one orthopedic surgeon. Like we have seen the movie Drishyam, कि भाई उसने वो दिन live किया था, उसको पता था कि ये लोग सच ही बोलने वाले हैं. That is the thing, that you have to spend some time with an orthopedic consultant surgeon, a week or so. Go see how he works, what are the timings of his work, do you like it or not, and then decide. It is not just based on some discussion, but it is better if you live that life of a orthopedic, shadow someone. I guess you will be more clear. Okay.
How
Next question, Dr. Satish.
Fellowship and MCH super specialty exams for ortho. So as I said, 2 options for fellowships. One, you go for a exam-based fellowship, entrance exam do FNB ka. It also depends on the field you want to pursue. Plasty, scopy, spine. So I will guide you about spine. Spine mein there are basically 2 main examinations. One is Association of Spine Surgeons of India. Entrance exam hota hai, jisme khali basically spine cover hota hai. The entrance exam is only of spine. In FNB, entire orthopedic things. जैसे NEET PG you prepared each and every subject, वैसे same way FNB में you prepare each and every subject, whether it is trauma, scopy, plasty. So each and everything regarding orthopedics you should know. And the ASSI exam for spine, that is only for spine fellowship. Spine fellowship के लिए आपको उसमें सिर्फ entrance exam में they will ask you only questions regarding to spine. So there are 2-year fellowship होता है. Getting into a fellowship is easy. There are plenty of fellowship options. दूसरा ऑप्शन होता है इंटरव्यू बेसिस पे. If there is a vacancy, you apply there, you go for interview. If you get selected, you join the institute. So fellowship options ऐसा नहीं है कि नहीं है. There are plenty of fellowship options. But the thing is, you should get into a good fellowship. rather than being into a fellowship. कोई भी fellowship तो आप offer हो जाएगा, but you should be to get a good fellowship is a bit tough. You will need to prioritize your thing कि आपको क्या एक fellowship से what are you expecting? Are you expecting hands-on? Are you expecting a good mentorship? So you need to prioritize those things. And to get a good fellowship can be difficult because majority of the students will be trying to apply for that fellowship. So the waiting time हो सकता है ज़्यादा. But if your CV is good, if you have given your interview good, then if you have impressed your mentor during the interview, I think मिल जाना चाहिए. I think Dr. Shailin and I fellowship हमको इतना struggle नहीं करना पड़ा, but I won't say ये struggle नहीं करना पड़ता. To get a good fellowship, थोड़ा बहुत struggle है, but yeah, plenty of fellowship options are available. Plenty of good fellowship options are also available throughout our country. And after that, you can go for an abroad fellowship as well. Abroad fellowship में the waiting period is there. You 6 months to 1 year का waiting रहता है, but eventually you end up getting an abroad fellowship as well. But your CV should be strong. Basically during the 3 years of residency and in SRship, आपके publications देखते हैं, आपके posters देखते हैं, आपके presentations देखते हैं. Your CV should be strong to get into a good fellowship.
Okay, next, Dr. Vaibhav is asking, hello sir, I'm getting private college in UP for ortho, where practice is decent and hands-on are also decent. Not good, as good as a government medical college. Is there a good idea doing MS ortho here? Yes, you need to inquire about different college of UP, that how decent is it. If you are getting independent hands-on, independently you are able to handle the cases, you can definitely pursue there. And you have to wait with the other options you are getting, and it's a like for like comparison. Okay. Next question I would like Dr. Satish to take up.
For every college in Tamil Nadu, there is 2 years bond. Can I practice orthopedics during those bond years? No, right? If I join the top DNB institute and do SRship for 2 years, won't I be a better surgeon? Yeah, I guess 2 years bond, but depends. It is not like that during the 2 years of bond you will not be able to do orthopedics practice. It will depend on the institute where you are joining. I also did a 1 year bond from the same college, that is Government Medical College Baroda, and I was doing orthopedics. ऐसा नहीं है कि you cannot practice orthopedics during this 2 years. The thing is, the bond place where you are doing your bond should be well equipped for orthopedic cases. And joining a DNB institute and doing a 2 year SRship, definitely skillfully you will be better. So mainly I guess के जो bond वाले years हैं, you can practice. And if you join a DNB and 2 years SRship, if you don't want to waste your 2 years bond, if you don't want to give 2 years bond service, and if you want to give up MS ortho, then you can also join a DNB institute. But as I pointed out earlier, if you are getting MS and DNB, I guess MS will be a bit better, will be a better bet than DNB. Dr. Shailin, your views?
Yes, I feel I agree with you that either way you are doing 5 years, 3 years of residency in both the things and 2 years of bond or 2 years of SRship. So you can select whichever is near to your home. If you are confused, there is a definite home advantage. You get a warmth from your family to go through your tough phase. So you can take a decision according to that. And practice wise, I feel MS will have a slightly edge because you will get more hands-on work. But still, a bond is also a thing you have to worry about it. And you have to take a call on that. You can even take from all India in different colleges across India where there is not a 2 year bond. It's just a 1 year bond. Like in Gujarat, there is 1 year bond. So you can even think about that options.
And in Maharashtra, I think the bond is of 1 year. Okay.
Yes.
Main doubt is still having most of the people whether to take general surgery. Can you please exactly the differences in both the branches? I guess Shailin has already pointed.
That is covered, I guess.
Yeah. Sir, I have a confusion regarding taking emergency medicine or ortho. Kindly give an opinion, sir. So, see, first you need to decide whether you want to go for a medical branch or a surgical branch. So, medical branch and surgical branches के pros and cons होते हैं. Medical branch, the settlement phase is easier. But general medicine, again, you have to give a NEET exam post your 3 years, and again you have to go for 3 years of residency in your super specialization. So पहले तो decide करो कि you want to go for a medical branch or a surgical branch. If you want to go for a medical branch, then definitely the settlement phase will be easier. But अगर surgical branch लेना, settlement phase will be difficult. But yeah, पहले तो मन बना लो कि medicine लेना है कि medical लेना है कि surgical लेना है. उसके बाद आप decide करो कि which branch you should do.
Yeah, that's right. I'll take up the question of Dr. Nihar, that he's being from Ahmedabad and considering my rank, NEET, which is better for ortho, GCS or MK Shah. See, that is again the thing about fish and fishing. You will have to ask your seniors who has passed out from GCS. I guess there is no ortho has not still passed out from MK Shah. But the general criteria which I would like to suggest you is, first, where you get a good working environment, where you get a good hands-on, and there are seniors. There should be seniors. You should not be the first one of your batch.
Yeah.
And so that will be helpful for you to select.
There should be someone to guide you. The faculty, the consultants won't guide you. They will just leave the place as soon as they can. But the seniors, they will be guiding you. They will be teaching you. हाथ पकड़ के surgery seniors ही सिखाएंगे. Consultants नहीं सिखाएंगे. So as Dr. Shailin rightly pointed it out, go to a place where there are seniors, where the working environment is good, where there are a variety of cases. You need to go there. If you are in Ahmedabad, you can visit the places. You can talk to the seniors right there. What are they doing? What are the protocols of their college, and what feels right for you? जिसमें आप fit बैठते हो, select that place. I think Pratik Singh is
Yes.
raising his hand. So if you have any doubt, you can ask it.
Hello, sir. Good morning, Shailin Bhai, Satish Bhai. I'm your
Yes,
junior
Pratik.
from Baroda Medical College.
Yes, we know you, Pratik. You're a very good volleyball player.
Yes, sir, thank you, sir.
Yeah.
I did my COVID duty with you, Shailin Bhai, during the
Yes.
COVID times. Yes, sir.
Yes, go ahead,
Sir,
Pratik.
yes, sir. I had 2 to 3 questions. One question, Satish sir has answered that fellowship is really hard to get. I have heard that it is very hard to get fellowships. In the future, you need very much contacts and थोड़ी जान पहचान है, ओळखान है, तो आपको मिलती है फेलोशिप्स, वरना आपको फेलोशिप मिलना बहुत मुश्किल है आने वाले टाइम में. ऐसा तो सर क्या ये सच में हकीकत है, ग्राउंड रियलिटी क्या यही है?
I would like to answer that. पहचान से मिलती है फेलोशिप्स, ओळखान चाहिए, but मेरी कोई नहीं थी. I got into a fellowship and I got into a good fellowship where there is good hands-on. So myth है, it is not like that. सब या तो अगर आप if you are worried about that, then you give an exam. You compete in an entrance exam. FNB दे दो, उसमें तो कोई पहचान नहीं चाहिए होती है. But yeah, if you have a reference, then definitely you have an edge. But I didn't have a reference. ऐसा कुछ नहीं होता. So ऐसा नहीं है, वो तो हर जगह है. ठीक है. Reference, if you get an reference in jobs में जाओगे, आप ऐसा सोचोगे अरे जॉब में रेफरेंस ये डेफिनेटली चाहिए, बट सबको जॉब्स मिल तो रही है ना. So don't worry about that. You can get a fellowship. It is easy to get a fellowship, but it is difficult to get a fellowship in a good place. And if you are worried about this thing, this पहचान वाला thing, then you give an exam. FNB दे दो, ठीक है. If you get a good rank, you will get a good college or institute.
Okay, sir. So,
I would like to add on to this, Dr. Pratik, that पहचान अपने खुद भी create कर सकते हैं खुद का. That you will do 3 years of your residency. There will be your mentors, your HOD. They are,
yes, sir.
if you do work for them nicely, they are the ones who is going to recommend you.
Yes, definitely.
Yes.
So पहचान खुद का create करना है, ऐसे ही समझ के करने का. And applying for fellowship early has a edge, I feel. So once you are in your 3rd year or end of the 3rd year, you should start applying for the fellowships you want. So you also have 1 year of waiting period while you do a SRship.
Yes.
Okay,
definitely. Applying for a fellowship early is very important. And also, Shailin को भी fellowships इतनी सारी मिली, वो कोई पहचान से नहीं मिली. So it is a myth. He also has done various fellowships from various good places. So it is
So
your
there are various places on Instagram and then they are saying that भाई आपको मिलना ही नहीं fellowship, आप ऑर्थो ले रहे हो, इतना सैचुरेट हो चुका है आप, मतलब इतना मुश्किल हो गया है। तो आई वाज जस्ट क्यूरियस कि क्या ग्राउंड रियलिटी है सच में ऐसी
आप
कि
कोई पेशेंट गूगल करके आता है तो उसका बॉम्बार्डमेंट कैसा होता है, तो स्टॉप यूजिंग इंस्टाग्राम। जस्ट यूज इट फॉर फन, देख के छोड़ दो भाई।
Instagram is going to give you information. It is not going to give you knowledge or the precision based like the what is the reality. वो तो ऐसा
Yes,
भी
sir.
बोलते हैं कि हाँ ऐसा हो जाएगा, like they are doing it for the views and all, but
Yes, sir.
you will be able to manage. There is after residency there is nothing that you won't be able to do. Trust me.
Yes, sir. सर व्हाट अबाउट सर ये लंबा ड्यूरेशन तक जो रेडिएशन एक्सपोजर होता है जो हम सीआर वगैरह यूज कर रहे हैं, इससे कोई हेल्थ प्रॉब्लम लॉन्ग टर्म पे ऐसा कुछ कैसा है सर, मतलब उसका बारे में?
डेफिनेटली रेडिएशन एक्सपोजर तो यार है ही। इफ यू आर वरीड अबाउट द रेडिएशन एक्सपोजर, देयर आर वेरियस थिंग्स, लेड एप्रन पहनते हैं हम, ठीक है। इफ यू आर स्टिल वरीड अबाउट द रेडिएशन एक्सपोजर, टेक अप आर्थ्रोस्कोपी।
ओके सर। एंड सर एक बहुत ही लेम क्वेश्चन है कि सर अर्निंग पोटेंशियल लाइक ग्राफ कैसे चलता है सर स्टार्टिंग? हमें सबको पता है कि एक स्टीप ग्राफ है सर्जन का, बहुत लंबा टाइम है, पर सर तब भी अगर आप जैसे आप एक निकलते हो, आप एसआरशिप आपने सपोज कर लिया, आप एसआरशिप में तो 1.2 कमा लेते हो, एसआरशिप के बाद सर एक कैसी जर्नी कैसी होती है एक सर्जन की, थोड़ा सा एक बता पाएंगे आप? सही रहेगा।
डॉक्टर शैलेंद्र,
Dr. Satish.
ओके।
I would like Dr. Satish to answer this.
सर्जन्स का ग्राफ हमेशा स्लो ही जाता है। डोंट वरी अबाउट द अर्निंग पार्ट, ये सही टाइम नहीं है अर्निंग पार्ट का। वो हर एक फील्ड में, एवरी फील्ड हैज अ सैचुरेशन, एवरी फील्ड के पेमेंट एट पार है। इफ यू गो इन अ टायर 1 मेट्रो सिटी, इफ यू वांट टू सेटल इन अ मेट्रो सिटी, थिंग्स कैन गेट डिफिकल्ट, थोड़ा टाइम लग सकता है। बट इफ यू आर पैशनेट अबाउट द ब्रांच, आपको ऐसा है कि नहीं ऑर्थोपेडिक्स करना है मेरे को, तो यू विल बी एबल टू फाइंड अ वे आउट, ठीक है। इफ यू एंड एज आई सेड, फेलोशिप्स करो, सुपर स्पेशलाइजेशन करो। अभी के लिए इतने सारे लोग नहीं कर रहे फेलोशिप्स, देयर आर स्टिल, मतलब अभी इट इज अपकमिंग, इन द अपकमिंग इयर्स एवरीवन विल बी डूइंग फेलोशिप, बट अगेन you need to stand out, you need to find a way, you need to work on it, you need to think about it, how can I stand out? And earning potential, see, for a surgeon the graph is slow, but once you become famous, sky is the limit. Surgeons का ऐसा रहता है। And if you want stability right from the very start, go for a medical branch, वो तो clear है। If you are a first generation doctor, you think नहीं stability चाहिए मेरे को, starting से ही stable मेरे को income चाहिए, setup मेरे को जल्दी करना है, then definitely you go for a medical branch, because setup investment कम होता है। एक छोटी सी OPD में you can start your clinic। जो रेडियोलॉजिस्ट है उनको इजी जॉब्स मिलती है, हाई पेइंग जॉब्स मिलती है, बट उनका ग्राफ स्टार्टिंग से ऐसा रहता है, धीरे धीरे राइज होता है, एंड देयर इज अ लिमिट आई गेस टू इट एज वेल। फॉर अ सर्जन, इफ यू पास दोस इनिशियल इयर्स, इफ यू पास दिस स्ट्रगल, देन स्काई इज द लिमिट। और ऐसा सोच के फ्यूचर में तो वी डोंट नो, बट इफ यू आर पैशनेट अबाउट इट, डोंट थिंक अबाउट द मार्केट पार्ट और सैलरी पार्ट या जो भी है, यू विल बी एबल टू फाइंड योर वे आउट।
ओके सर, बस सर इतने डाउट्स थे, थैंक यू।
ओके,
Yes.
चैट बॉक्स में जाते हैं, क्वाइट डाउट्स,
Yeah, we'll just
फंडेड
थोड़ा
आउट हाँ। Sir, would it be better to take a college near my home place in Kolkata, or taking a college in Mumbai, which I have heard is better, comparatively a better option? I think a better college is definitely a better option. Don't think about the home advantage if you are getting a better college. If the college is similar, if you are having equal exposure, then you can consider your hometown advantage. But if the college is better and you are, then you should definitely go for that college. Don't think about the part. Yeah, you will face some challenges, जो वो challenges होंगे, but I think अगर tackle कर लिया तो it will be quite easy for you.
Dr. Ishan is asking, sir, between LG Hospital and NHL, which should I prefer? I guess you should prefer the one in which there are good number of cases which you will be operating, and the consultants won't be doing the majority case. It is the residents who should be doing the majority cases. And I feel LG has a better potential because there is a NHL, the VS hospital, the SVP hospital has become like a corporate institute. So I would go with LG in this case.
Yeah, definitely. If I was at your place, I would have chosen LG.
Sir, is DNB ortho really that difficult to pass? Dr. Ashwin Devraj, no, it is not that difficult. More than 20-25% of people are passing. Have you compared your pass rate in the NEET PG examination? How many people gave and what is your rank? You are in the less than 20% of people. So you are definitely going to pass that exam. Don't worry about the pass rate.
Are women hired in consultant positions, especially sports medicine? Can only arthroscopy sustain a practice? Yes, women are hired in consultant positions. So don't worry about that. There is no gender discrimination now. And in the upcoming years, और भी कम हो जाएगा. Sports medicine is a fantastic branch for for a women orthopedic, for a female orthopedic, because it is the finesse which we require in arthroscopy. And can only arthroscopy sustain a practice? If you are doing only arthroscopy practice, initially you might not get the cases, but if you portray yourself, if you market yourself that I am an arthroscopy surgeon and you are doing really good, then I think only arthroscopy can sustain a practice. Dr. Shailin will be a better guide to you. He's a sports medicine surgeon.
I guess definitely there is no gender bias, and you have to think, you have to compete with everyone. It is a fair competition. If your skill set is good, your surgical hand is good, your academics is strong, definitely you will be hired based on your merit. That is what I feel. There is no gender discrimination between men, women. It is the merit that will determine. Next question I would like Dr. Satish to take up.
As a first general doctor with no backup, having 3-year bond after MS also, it is why choose ortho is settlement very difficult for first general doctor considering situation also. As I live in small town and here only there are 15 orthopedicians. I think ये हमने काफी cover किया है कि don't worry about saturation. 3-year bond after MS ortho, yeah, it can be difficult. 3-year bond थोड़ा लंबा हो जाता है. Is it wise to choose ortho? Then as Dr. Shailin already pointed out, choose a college where there is a less bond, and you are from a small town where there are only 15 orthopedicians. So you need to see those 15, how those 15 orthopedicians are practice. How is their practice? If you are getting good number of cases and there are only 15 orthopedicians, then there is less competition. And if the patient load is high, then you will be able to make good money. But yeah, 3 years bond थोड़ा ज़्यादा हो जाता है. It can be difficult at times. So choose a college which is having a less bond period, I guess.
Yeah, and you are lucky you are staying in a tier 2, tier 3 city. Nowadays, the competition is rising so much. It is very difficult for a tier 1 city. You have to have lots of super specialization. Your skill set should be extremely high. Then only you will be able to sustain in a tier 1 city. And for a tier 2, tier 3 city, when you do your fellowships, then you are going to be doing great in the cities.
Yeah. So
next question by Dr. Yeah. Yes, Satish.
First year also resident, what should be your academic learning goals by the end of first year at least? First year के end में ward संभालना आना चाहिए. ठीक है, you should be able to handle the ward. You should be able to do that things. Don't think about at the end of first year. Don't think about the learning part. वो second year से चालू कर सकते हैं. Yeah, so don't think about that. But हाँ, first year में we used to do some surgeries, tibia nailing, rush pin, थोड़ा बहुत वो. तो mainly clinical part you should be clear about in the first year, and you should be able to handle the emergencies. You should be able to handle the wards. ये सब आपको first year के end में matter करेगा.
Yeah, ठीक से प्लास्टर लगाना आना चाहिए. That is what is expected from a first year. And बस सीनियर का काम कम कर दो ना, तो तुम्हारा रेसिडेंसी बहुत स्मूथ हो जाने वाला है. The focus, we had some ground rules that सीनियर के OT होने चाहिए, सीनियर को तंग नहीं करना है, तो you will be living a very smooth journey in the residency. Sir,
please explain about its exam duration and can still be earning while doing fellowships. Yeah, fellowship paid होते हैं. Type salary मिलती है fellowships में. Exam होता है FNB का, and as I said, 2 years उसके बाद fellowship होता है. And during that fellowship, you get paid. You will be able to earn during those 2 years of fellowship. Is life becoming hectic? Yeah.
Yeah, Dr. Setu is asking, is life becoming hectic after completing ortho? How is work-life balance? The work-life balance is good. That depends on how ambitious you are, how many working hours you want to put in. For a fresh pass out, I guess the work will be high. You have to run about to go to different hospitals and find work. And gradually, as you become famous, as you become well known in your community, then you can focus on a life balance as well. But for initial, you will have to do work more.
So Saket has a doubt, which is more important, academics or hands-on? As I already pointed it out, hands-on is important. Sir, can women manage work, family, and free time if they take up ortho? Why not? As I said, they can manage. It is uh, support of the family is needed, yes, but yeah, if there is support from the family, and if you are willing to manage everything, then you will be able to manage. I think females को ज़्यादा manage करना आता है males से, so I don't think so there will be any problem with that.
Yeah, definitely. कर ही लोगे मैनेज, ऐसा कुछ नहीं है. एंड अपने ओबीजीवाई के कंपैरिजन में देखे तो देयर आर लेस जेन्युइनली ऑर्थोपेडिक इमरजेंसीज वेयर रात को कॉल अटेंड करने जाना ही पड़ेगा. वन ऑफ योर स्टाफ और योर ब्रदर और सिस्टर वुड बी एबल टू हैंडल इट इन द हॉस्पिटल इटसेल्फ. सो तुमको खाली ऑपरेशन करने के लिए या फिर थोड़ा बेसिक मैनेजमेंट करने के लिए जाना पड़ेगा इन द इमरजेंसीज. एंड सच प्योर ऑर्थोपेडिक इमरजेंसीज आर वेरी फ्यू व्हेन यू कंपेयर इन द ओबीजीवाई. सो ओबीजीवाई में अगर लोग कर पा रहे हैं तो ऑर्थो में तो आराम से विमेन विल बी एबल टू हैंडल फैमिली, फ्री टाइम, एवरीथिंग. बट दैट इज आई एम कंपेयरिंग आफ्टर योर कंप्लीटिंग योर एमएस और डीएनबी. इन रेसिडेंसी थोड़ा डिफिकल्ट होगा, बट उतना डिफिकल्ट सबके लिए होने वाला है. तो जेंडर से कुछ फर्क नहीं पड़ता है उस चीज का.
So from Ahmedabad, he's getting Ayush is getting GMC Jamnagar, Bhavnagar. What would be a better choice, LG Ahmedabad or any government hospital I get in state? Fine orthopedic surgeon. Government hospital, I guess, is better. Definitely, government hospital. How do you get clarity between general surgeon and ortho? मैंने बताया आपको दो चीजें थी. तब मेरे को ऐसा था, शैलिन के साथ आई डिस्कशन विद डॉक्टर शैलिन, एंड ब्रांच है, एंड उस टाइम पे कबीर सिंह को देख लिया, क्लैरिटी आ गई. And also, yeah, I worked there for a week or two in orthopedics department to get more clarity. So you can do that.
So yeah, we have to shadow someone to get more clarity about it. Ask someone different views regarding general surgery and ortho.
Okay.
Dr. Dhruv is asking, sir, is there any actual physical mental toxicity we can expect from ortho in majority of the government hospital, or is it only the high workload which people misinterpret as toxicity? I would say there is a very good question from Dr. Dhruv, and there is no physical toxicity as far as I know. People are not going to force you to do anything. The mental toxicity only would be related to the work. Yes, there would be some bad elements. Some of the seniors would be a bit of trouble to you because they might have some disturbed life or mental health, but these are a very small subset of population. So if you do your work perfectly, nicely, on time, then I don't think there is any toxicity. It is with the higher workload comes higher toxicity. So and in a way, it is good that your college would be having a higher workload, high number of OTs, high number of patients. So to manage that, you have to be strict on your juniors to get the work done on time. If you're not able to get the work done, there will be a bit of toxicity. But I'm sure that the era of physical toxicity is ended, and none of you is going to be beaten or anything. They are not going to touch you. And the laws for ragging and all are very strict. So if at all that is happening, you can always report to the higher authorities.
Definitely, काम करो. There will, if you are able to work, if you are able to complete the work, there won't be any toxicity. Government hospitals में definitely काम ज़्यादा होता है, तो थोड़ा बहुत seniors होते हैं. But same senior काम खत्म होने के बाद, emergency खत्म होने के बाद आपके साथ मदिरा पिएंगे.
Okay. Dr. Aryan, at my current rank, I am getting some decent college in Karnataka, around 8 lakh per annum payment, and a few DNB seats in private or corporate hospitals in South Indian. I'm a bit confused about what would be a better choice, MS or DNB, since both of you offer a similar practice profile to me. Could you please guide me? What would be the wiser choice? I've already kind of solved my doubt with the earlier reply, but a more personal one for me. Okay, Dr. Aryan. Fees 8 lakh per annum, that is going to be your family call, whichever you can find suitable and balanced for your family. And there is an option of few DNB seats in private or corporate in South Indian state. That is actually I would say, a personal call you have to make, that are you willing to leave your hometown for a better seat, better college? I would definitely say you have to go to a better institute, but a comparable institute you are getting in your hometown, then there is nothing like it. You're a bit confused between better choice MS or DNB. I guess we have had enough discussion regarding MS and DNB, and go with where you get a better hands-on and better trauma. To just summarize, I would like to say that.
Yeah, definitely.
Dr. Satish would like to add something.
Yeah, MS or DNB, definitely MS. If you are having a good government hospital, MS, definitely MS, as we pointed out earlier.
Yeah, so I think we have completed majority of questions, and also if few people have doubt remain, I think we will upload this video, and I think you both have discussed so well everything. Like if someone is choosing the ortho, he just need to watch this video, and he will get all the doubts clear for DNB purpose or everything. So in last, if you want your add something, Shalin sir.
I would like to just conclude by saying that whatever you choose, see, you are at a very tender age that the things are going to be difficult for you to select. And we were of the same doubts as you were today. We were before a few years. So once you make a decision, back yourself that this is the decision and you are not going to doubt for it. There will be times in residency of ortho residency especially that you will feel like quitting, but don't. Once you have made the decision, be sure of that and back it till the end of your life. That is how sure I want everyone to be. Then, because if you won't be doubting yourself, no one in the world is going to question you. But if you are concerned कि भाई लूं ना लूं, अगर ये हो गया तो, अगर ऐसा हो गया तो, then people चढ़ जाएंगे तुम पे कि भाई नहीं मैंने तो बोला था मत लो, इतना टॉक्सिसिटी होता है, ये होता है, वो होता है. But everything is external noise. If you are at inner peace with yourself, if you know what you are doing, if you back yourself, no one is going to stop you to become the top orthopedic surgeon in India. That is the potential this branch is going to offer you.
Yes,
Dr.
Dr. Shailin rightly pointed it out. Don't worry about the saturation, don't worry about the toxicity, don't worry about the earning. वो सब छोड़ के बस काम करो. Work well, focus on the basics. You will get the things right. Yeah.
True. So I think we can conclude the session. Thank you so much, sir, for both of you taking out the time and explained everything so great. Our 1 hour session went to 1.5 hours. So thank you so much for the time. Thank you so much, guys, for joining, and best wishes for the counseling. Thank you so much.
I would like there will be a feedback form shared with you in the group.
Sure.
Request everyone to fill it out and submit it. Yeah.
Sure.
Okay.
You will share the feedback form with an email. You will get the email. Just check your email, and maybe in spam folder also. Sometimes the email get in spam. So just check the spam folder if you didn't receive the email. Thank you so much, guys. Thank you, sir. Thank you to both of you.
Thank you. All the best to everyone.
Okay.
Thank you so much.